God rest his soul, Dr. Goldberg, was actually the one that told me to reach out to you because, it's interesting because I did this about 8 years ago and a lot has changed. But when I started doing this, I feel like there was nothing on social media, that I had found. I was really ignorant to infertility, had no idea what that was all about. But I seek him out when I'm about 33 because I was starting to have bleedings, heavy bleedings. And I walk in and I start telling him my symptoms. He goes, so he's the one that tells me, you have endometriosis, but let's do a laparoscopy to confirm. And so we do. And his approach was very much like, why sit around and wait? You guys are trying to have a child. It's been 6 months. You guys have been trying. Go see Dr. A. And I'm like, what, why? And he's like, just because of fertility and endometriosis. Infertility and endometriosis kind of go hand in hand, but without scaring me. And then, so he's like, I think it's a great way to start. Just go see her and then see where it takes you. And then I walk in and I meet you. And then immediately I felt like, okay, I'm safe. There was this sense of curiosity from you to get to know me and my body. And I appreciated that because it wasn't like, this is what's wrong or I could fix. It was more like, let's figure it out. Let's see how your body works. Let's, start doing some tests. And that to me was very important, that it wasn't like you were trying to analyze me, we were just trying to figure it out. And then once you got some numbers, you were walking me through it. I didn't feel overwhelmed by the numbers and all of the terms and everything that came with it, terminology. So the first round of IVF was different from the second round. So ignorance is bliss. And that's how I got in. I had no idea what anything was. I just walked into your, office and then I was just like, oh, I guess we're doing this,
Yeah, I still remember listening to how your menstrual cycle was. And I was like thinking, I wonder, because the flow was so heavy and it had changed.
Yeah.
And the uterus is like your bicep, it's a muscle. And when we did the first ultrasound, I thought there could be some adenomyosis because the muscle layer above and below. But I try not to be an alarmist.
Yeah.
I try to think through on behalf of all the patients, and I love all the patients so much, especially you. But what can we do to take action? Because sometimes people think, why is this happening to me? What's wrong?
Yes.
And all these cascades of emotion. And I think our fear as women, there's always the fears we have of like, what did I do? Yeah. And it's not necessarily because it's probably genetic and environmental factors that played a role. And I think at the time, I do remember thinking when I saw your anti-Müllerian hormone level, how am I going to discuss it? Just because it was at a level that wasn't as optimal for your age at the time.
Yeah.
And so I think that was sort of fascinating now in hindsight, seeing it and seeing other patients. I'm like, oh, there's always like a good egg.
Yeah.
You just have to finagle and find it,
Yeah. So I think that from my experience was that I had no idea about infertility. Honestly, I didn't know that was like, because infertility was for me two things: after 40, two, but I'm having my period, so I should be fine. Even though it was like heavy bleeding, I was taught like, well, as long as you have your period, monthly period, you can have a child. And all my life I had been prepared not to get pregnant.
Yeah.
And so to get pregnant, I was absolutely ignorant to the like, how do you get pregnant? Aren't you supposed to just, be intimate, have intercourse, and then there you go? Maybe 1 try, 2 tries, 3 tries. So I honestly was very, very ignorant to the fact of like the complexity of the matter because I was just never told that. And so again, at 33 is when I find out I have endometriosis, do a laparoscopy to confirm that. And then I'm guided to come and see you. And then we kind of get started right away. So I just turned 34 when we started the treatments. And then again, 9 years ago, I'm turning 42.
Oh my goodness.
9 years ago. I was, there was no social media. There was no hashtag fertility warrior.
No.
There, you know, it was very much a stigma. And I felt it. So coming in, I also was like, after I was informed about what it is and how it's working, and I started doing research about it, I was like, what's wrong with me? Why isn't it working? And then a huge part was also I was very overwhelmed by the price of it. That I had to pay the price of having endometriosis. That's just like really broke my heart. That we have
now there's a lot of fertility coverage,
Yes.
which is a shift.
Yes.
So a lot of thank goodness that makes more sense because a lot of the time, especially if the fallopian tubes are closed, it's not necessarily anything that's due to the patient's issues. If there's endometriosis or some prior appendicitis that made an infection, then sometimes there's the risk of tubal factor and untreated infections when we were in college or something like that can do that as well. And so I think an awareness, it reminds me, and I think you'll think this is funny, but at the two of the colleges in LA, I give a talk on how to protect your fertility to sorority girls, because one of my patients helps make all the sorority like paraphernalia to wear, and so she's like, you have to give an awareness to these young girls. So I try to talk to them, but I think also having what you said resonated with me is that so many times we're so like careful to not conceive. And then finally when it's the right time in our life, our career, our goals, and then it feels like this uphill climb a bit. And that the stages of how people approach it, where you feel upset and hurt from why is my body doing this to then acceptance. Then I notice that people can take the action plan, and I do feel like I worry with you guys. So then it's like together we're trying to accomplish the goal. So it's been an honor to take care of like such caring, nice patients who are very proactive. Because you were one thing I do vividly remember too. I was like, we could do this plan or this plan, but the statistics of success are higher if we think about IVF. And then we were weighing the pros and cons and trying to contemplate what to do. You know,
I'm actually happy I didn't do an IUI or anything like that, because I just feel like it would have drained my energy. We went directly to IVF. I know I wasn't a good candidate for the IUI anyways. So I know, like, I've heard so many stories now that like we start with the Clomid and then there's the IUI. We do several of those and then we go over to and that has exhausted the patient or the person. So by the time they get to the IVF, they're just like emotionally and physically exhausted.
And the dynamic with your partner.
Yes.
Because sometimes that dynamic, there's this whose fault, and I don't like, it tends to be a combination of different factors. It's never very super straightforward what the causal factor would be. So, you know, but
I remember, so again, like everything we were doing, it was my first time. I had no idea. I'd never read about it. I'd never heard about it really. And so the stories weren't shared the way it is today on social media, which I think is honestly the most, IVF warrior community. They're incredible. And, you know, I advocate for it too, because I think it's just having conversations and being able to relate to each other's journey while understanding that each and every one of us have an individual, very specifically tailor-made journey. So we can't really relate to the science experience of it all, because we're all going through different things. But for the emotional experience, we definitely do. But I remember like when first we got the 17 eggs and I'm like, wow, I have 17 eggs. But then it wasn't really that good. And then for a 33-year-old, but then we got the 4 embryos and we had 2 boys and 2 girls, which was like perfect. Cause then I'm like, at least that'll be a surprise. So you got to pick the first, one. Remember, I'm like, just pick the healthiest one. Yes. And you picked my baby Shaw. And, And so the first round was really like this euphoric experience of like ignorance is a bliss, because I didn't know too much, honestly. Because once you start digging and looking at those numbers and becoming like obsessed with it a little, because I mean, you want to be in control.
Yeah.
And it's so hard to be in control of something that you really are like, kind of, it's your body, sure, but and you can help it. But at the end of the day, it's doing its best.
Yes, exactly. That's right.
So you kind of have to give a little bit. And I think that's what helped me a lot to have the experience that I had. And I had a challenging second transfer, which we can talk about. But for the first one, I feel like I was truly picking the doctor, picking the fertility specialist is the number one priority for you to connect, feel safe, and feel like this person's approach and this person's energy and experience or whatever it is up to par with what it is that I'm looking for. And then you got to let it go. And then you got to just, give to the experience of like, I picked the best one for me, but then I have to trust. And I think I really did that with you. I truly trusted you through it, and was certain that you would do your best. And for that gave me a lot of certainty that, I mean, there's so many things that can happen. And it did. You were running tests. So 1 month we prepared for a transfer, and then you're like, oh, it's not looking good. Remember, my mom had booked a ticket to come.
I know. And it was hard because, the lining didn't get to the exact target.
Right.
And we found that that's so important when we're planning the transfer to get the thickness of the lining and the estradiol and progesterone perfect.
Yeah.
And it was like not exactly on our target. So I had to make the hard decision to hold because the embryo's frozen. So it's not like we would be compromising that. And so it was a joint effort, but it was a hard decision at the time.
Yeah. And my mom had gotten the ticket. She was coming. We had planned for this transfer and it didn't happen. But that's what I'm trying to say. But when you have certainty and trust in that I picked the best doctor for me, then it's okay. Like it becomes okay.
Yeah. I find it hard because sometimes I know a lot of patients tell me everything like I really want the due date on a specific day and it's because I want this and that or something like that. And I say, okay, well, we're going to do everything in our power, but it may not play out exactly that way, but we'll put it, as our overarching goal.
Yeah. It was so funny because right when you're saying that, Ryan was like that. He's like, we should not have a Gemini. We should have a Cancer baby. And I'm like, are you kidding me? I'm just trying to survive this. And you're trying to figure out what the number and the due date and the numerology. And I'm like, oh my God, are you okay?
It's interesting because my kids are close in age. And at the time I thought, okay, if it takes like a year to conceive, I better try to start ahead of the game and think about it. And then nature sort of had its own plans. So my kids are close in age, which is nice. It's been a joyful thing, but as knowing too much and I was older and like near 40, so I said, oh, I better like see what I'm gonna be doing. And and my own AMH was low, so I felt like sometimes when patients have this like crisis moment of awareness and then they're reading online and AI, which I want to hear all about your knowledge on that, but on these things, is that there's a lot of almost information overload.
It is.
And then a lot of our parents' generation didn't know any of their hormones or ever get an ultrasound or anything.
No.
And sometimes when I know I'm going to be calling a patient with an AMH or anti-Müllerian hormone level that could be a little lower than their age would predict, I do think it's information overload because we have access to so much information, but each person, like you said, is their own sort of being, and we have the opportunity to have good eggs at any AMH. It never was used to predict who's going to get pregnant. It was only used as a tool in conjunction with age and our follicle count and all the health information to decide what protocol or what medication people might need to get ovulation induction and stuff. So it's interesting to think back to that time too.
Yeah,
I know,
because you really don't know, even though like you can be informed, but it's still, and I like to talk about this a lot because going through IVF, I really felt like it had become like this scientific research kind of on my body. And I thought that, wow, am I losing like the whole divinity and a divine experience of it, of becoming and creating? And I always tell people, it's like I got to experience what God does, in a way where you get to, exactly the moment, the egg became, right, with the sperm, and then it becomes an embryo, and exactly what day, what hour, and then we froze them. And so I feel like I got an overview over that. And then another thing is that at the end of the day, it was really like it's God's way, regardless, because we remember we were all praying once we did the transfer. And I really felt that energy, because at the end of the day, you did your best, embryologist did his best, we all did our best, right? But it's still up to, that energy, universe, whatever you want to call it, to complete it. And that was truly such a like out of body experience for me, because initially I was really upset that I was going to be like this lab rat, coming in here and giving blood every day. Like my initial thought was like, oh no, it's going to feel like, a lab rat, but it wasn't. It was such a divine like experience to be able to see how fragile and how sensitive it is, and what it takes for women normally to just conceive and like do that. And now my body isn't working. We're using, this great, wonderful science, but it still doesn't take away from the fact that it's still not up to this. Like there's still this small, spark that needs to happen.
Yeah.
Yeah. That was nice. I like that part a lot.
I'm placing the embryo, and I do always feel like, I know it's like this force of nature and like connection. And then I actually sometimes think, if the egg retrieval, when we got that egg, if this egg was like the hardest to reach follicle, that was like the one where you had to try to get that follicle to get the egg, and then I whenever we do best embryo, or sometimes again like third best or fourth best embryo, is the one that is destined to become a healthy full-term baby. It's not, it's always sort of like magical in a sense of where it decides to implant, how that development occurs, and the connection.
Yes.
It's very cool.
It's still up to it. Yeah. Okay. Yeah, because like again, I had 4 embryos, 2 boys, 2 girls. So out of the 4 embryos, so Shaw that you got to pick was the best quality one, but and then there was the other boy, then it was a girl, and then it was Laylee. And so we did a transfer of a girl, because the next transfer I wanted to have a baby girl. And so now we knew, and we were picking, but picking the healthier embryo out of the 2 ended up not working out. And so I was left with the least favorable embryo that ended up becoming Laylee. So you really don't know. And it's like, I try to convey that to anyone that like turns for, some kind of insight, connection, advice. I'm always like, you cannot calculate. And that'll be the downfall of you. If you try to calculate the outcome, because at the end of the day, it's not like chance. We're working hard to getting it done, but you really don't know. So my least favorable embryo ended up being the strongest.
She is.
And
I see your posts.
Oh my goodness! I'm like, were you the least? What the? Yeah. Yeah. She is such a strong, beautiful, and I had the best pregnancy with her. She was strong. She grew so strong. She was much bigger than Shaw when she was born. So it's quite interesting. But I say that in it's a relief to know that, you know what, at the end of the day, you show up, you do what you're told to do, you take the medication, you live healthier, you make healthier choices. I mean, I was doing the, what is it, needle, the acupuncture. I was doing it all, right? Like I was doing the juice cleanses, and I was doing all of that. But honestly, at the end of the day, I personally think it was just like this certainty that I'm in the best care. Let it go. Timing was off, so I was alone, had no help, going through it. And it was during a time where COVID had hit.
Yes.
It was like
couldn't
bad.
have anybody in the room. That was really
Couldn't have anybody.
hard.
And even if I did, he's in logistics. So his business took off, and he was essential business. So he was trying to survive that. I had Shaw. I mean, it was terrible. It was a terrible time.
Yeah.
So, and then friends too. I think a lot of people don't know how to support you through it. But that experience taught me so much. The importance of support and who you surround yourself with, because this is such a unique experience that you sometimes expect like your sister or your best friend that's always been there to be able to be there for you, but you often find that that's not really unless they've been through it, because people are really ignorant to what it really takes to get to a certain point. So for me, the failed transfer was a miscarriage. Like I'd lost a baby in my head because I created it 2, 3, 4 years prior, and it had taken so long to get to that. So it wasn't like, so I was being told, but it was an embryo. Thank God it was this embryo, and that would infuriate me. And I'm like, do you know what I had to do for this embryo? You know how many shots I've taken. So that would just like really infuriate me. Number one. Number two, I was told twice by 2 different people, you're hormonal. And that, because I was, because I had a lot of hormones. Like, what are you talking about? I'm going through a hormonal treatment. Of course I'm hormonal. But that, it was like in a way where it was condescending, and I didn't appreciate that.
Feel like it connected with
No.
what you needed.
Exactly. And so that's when I turned to the IVF community, and I found a lot of support. Like, you're not crazy, and your hormones are there, and you're okay, and there's no judgment. And I really appreciate it so much, to the point that I obviously started the International Fertility Foundation, which 2 things: advocate for infertility or fertility treatments as a fundamental human right, right? Because
it is.
Humans need to procreate for evolution. So we need help to do so sometimes, and that's okay. And we should get that. So that was the first advocacy. It's a human right. The second one was just information and support, right? And just talking about it. And we had you and other great doctors and physicians to just come and talk about what's out there and what you can do, and get some tips and tricks, but mostly like, hey, we're here for one another, and to provide, your network of people that you gather.
Conversation. It's always really hard because it's hard for me too when it's a call on that negative pregnancy testing, because sometimes as doing it, you think, this could be fake. Is the blood test not accurate, or why would the embryo roll and not find the receptors to attach? Could it be that the uterus had contractility, or this possible adenomyosis, which is where it's endometriosis in the muscle layer? And then thinking about the protocol, that we used it before and it worked. So it's like trying to mimic the protocol that worked successfully. So there's a lot of like different factors. I think ultimately we don't know if it's the embryo or the uterine contractility or the immune system. And sometimes it's just the chance, or that if the embryo would have had other health issues. There's lots of different ways to think it through, but ultimately it feels so hard. And it weighs also on the team. And my team is so like caring and dedicated. And so it's like this whole team thing. Then we do a meeting to try to understand, okay, how can we optimize everything for a subsequent try and get the best opportunity, but we want you to feel well as well. So,
Can I ask you that? Like, how do you feel when
it
it's
hurts? I actually sometimes cry like in the bathroom. But it feels hard because at the time, with the linings perfectly thick, the hormones, you mimicked a protocol that was successful. It's ultimately the embryo, really, but it feels like a lot of different variables that you're trying to tease out. And as a scientist, I think Like,
Yeah.
what else can we fix
Yeah.
to get the next?
But do you
one to
feel
work?
ever like, oh, I should have done or would have done and could have done?
Sometimes it, like occasionally patients will say, I didn't want to tell you that I was vaping or using
Oh,
nicotine or
yeah.
and then they'll have this overwhelm. But I always say there are people who do that and they get pregnant spontaneously.
Oh,
So
yeah.
I wouldn't think
No, I
it's
meant
that
like
as
for
the
you.
cause.
For you,
Yeah.
do you ever feel like, oh, maybe we shouldn't have done it that way, or like,
Sometimes, yeah,
okay,
sometimes I'll always think it through. Now, what I do, which has been over many years, learned over the years,
mm-hmm.
is I think, why wouldn't this embryo implant? So
Mm-hmm.
let's check everything we can think of beforehand.
Yeah.
Because sometimes people wonder why our tests are so detailed before a transfer.
Yeah.
And it's because we've included tests of what we would have done if an embryo had not implanted.
Yeah.
Which is also some of your tests too, which are called antiphospholipids and like all these optimization for thyroid levels and everything to get everything as perfect as it can be,
mm-hmm.
so that we tend to avoid feeling like, I wish I checked this or that, because we have a list of things that we do ahead of time.
Yes.
Yeah. And then being physically fit. So a big question after baby one is, are you back to your pre-pregnancy weight?
Yeah.
I wasn't when I was trying for number two.
And I'm like, who is?
I was like, it took me like,
so
my
long.
body was like not myself. Like, I mean, it felt like really challenging at the time too. When you were going through that, I noticed sometimes for the support system, it tends to be almost better if it's an outside, not our sister or cousin or a friend who's been through fertility. And I work closely with many psychologists who are so wonderful too, or the support groups. The partners need support. I do always check on the partner. I call them as well. And then sometimes they say they have to be strong for the partner.
Yeah.
And then when I talk to them on the side, they'll cry, and it's very emotional.
Yeah. But I just want to lastly tell you something. So, when I asked Shaw specifically, because when I hug him and snuggle him, and he's like, no, mommy. And I say, I get to do that because I made you. And he goes, no, you didn't. First, grandma made me because I was inside of you when you were inside of grandma. He knows about this is like my child. And then he goes, and then it was you and Dr. Alexander. And I'm like, that's exactly right. It's exactly what it was. So like, he knows that it took a village for him to get here, but he feels special. Isn't that incredible?
I carried him. Remember when you brought him in? And that picture went everywhere, and even my own mom has that picture in her phone.
Yeah, that's so sweet. Yeah, and every time we drive by, and he goes, that's where we were created here, Laylee. This is where we were created. So he knows where he was created and where he was born.